President, I move that this House supports the motion in my name.
Which motion are you...
I shall read the first motion.
You shall move them. Okay.
That this
All right.
House, A, notes the tabling in Victoria of John Ryan's independent review into the operation of the North Richmond Medically Supervised Injecting Room, and his report's conclusions that A, up to 63 lives have been saved during the trial period, and B, that the facility should now operate on a permanent basis. B, notes and welcomes Labour's acceptance that, as set out in its 2019 policy platform, that drug and alcohol policy should be based on evidence of what works and what does not. And C, calls upon the McGowan Government to review the drug injecting room evidence from Victoria and to report back to Parliament within the next 12 months on the potential to roll out a similar programme here in Western Australia.
Members, the Honourable Brian Walker has moved that motion, and the question is the motion be agreed. The Honourable Brian Walker.
Thank you, President. Let's get myself organised just now. You see, I seem to recall on a previous occasion supporting that's the first debate on cannabis reform, that there was a lot to admire in the policy platform of the Labour Party in WA. It's an impressive document. That admiration extends to the comment on page 135 of that policy platform, which states in clear terms that drug and alcohol policy should be based on evidence of what works and what doesn't. That's a laudable position to take, members. It echoes the Premier's calls that we follow the science and leaves the way open to some potentially life-saving reforms based on evidence gathered here in other states and territories. Now, when it comes to medically supervised injecting rooms, I want to stress at the very outset that I have seen the damage that illicit injectable drugs can do in our community. I have seen the death, I've seen the destruction, I've seen the evils that abuse of drugs can cause to the individual, to the children, to family members, and indeed society in general. I am absolutely against all abuse of drugs, and in no way am I encouraging their use. I'm sure I have the support of all members in this chamber. But it's also an incontrovertible fact that people do abuse drugs and will continue to do so. Another incontrovertible fact is that people do now and will continue to use drugs intravenously. Prohibition has not stopped that, nor will it. People die. One of my less pleasant memories is of fighting in the ICU to save the life of a young man who was slowly, inexorably fading into death due to the mixture of drugs he had taken, the effects against which we had no countermeasures. I don't recommend you do that. It's quite destroying. The simple fact is that medically supervised injection rooms have been shown to save lives. And having been on the other side of the equation, I am committed to saving as many lives as possible. Now, you might say, as some have said, I don't think you would, but you might say that those who abuse drugs deserve death. I believe I can speak on behalf of all of us here when I say that I disagree. I disagree with that populist opinion. We, all of us, must do what we can to allow people to live their best lives possible. I'm sure you all share that point of view with me. I know I can count on you all to share that opinion. But I just told you that the medically supervised injection rooms saves lives. On what do I base that claim? There's a report by John Ryan released a little over a week ago in Victoria. It's the first of two reports, with the second expected any day now. I'm looking forward to it, which looks at the lived experience of the medically supervised injecting rooms in Richmond. Now, in case you're unaware, it was started in North Richmond 5 years ago, in 2018, so that's a 5-year trial period, quite substantial. And Mr. Ryan is a pragmatist. He notes up front that safe injecting rooms are not a silver bullet, but he goes on to mention that they do save lives. His report estimates that there have been more than 6,000 overdose events during that time in the North Richmond facility, 6,000 in the facility. But none of these have proved fatal. Indeed, the modelling that they have done suggests over that time of 5 years, 63 lives have been saved through the establishment of this trial. Or, put it another way, that's about 16 lives saved every year. Now, I want to share some figures with the House from another publication by the National Drug and Alcohol Research Council Centre at the University of New South Wales in July of last year. It's entitled Trends in Drug-Induced Deaths in Australia, and it'll be clear why I'm referring to that in a moment. It estimates that there were somewhere in the region of 1,865 drug-induced deaths across Australia in 2019, 67% of those being accidental. More interestingly, it goes on to state that the highest rate of drug-induced deaths was observed in Western Australia, for the third consecutive year. 9.9 deaths per 100,000 people. That's shocking, members. And worse than that, those 3 consecutive years seem to suggest we're not having a great deal of success in tackling the problem. We're already behind our neighbouring states and territories, and my fear is that if we don't learn the lessons they can teach us, lessons like the establishment of the medically supervised injecting room, either full-time or as a trial, we're going to fall further behind, and to the detriment of some of our most vulnerable citizens. So I can't put it any more plainly than to say that safe injecting rooms keep people safe. That said, they also do other things, and the Victorian report highlights those. I'll quote this. The MSIR has also played an important role in reducing ambulance call-outs for opioid overdoses in its vicinity and led to fewer overdose-related admissions at its nearest public hospital emergency department. It has also contributed to reducing the spread of blood-borne illnesses such as hepatitis C and, of course, hepatitis B. These achievements are all the more significant, he says, because of the complex needs of MSIR clients who are often living at the margins of society. So the injecting room, you see, connects people to a general practice and a dental surgery, as well as a range of other health services, which has an obvious improvement on the health of the users overall. It's quite to be expected. If you're going to be marginalised with a facility which caters for your needs, you're going to be able to access the services you wouldn't normally have accessed. Is there any reason why we in Western Australia would not want to see that sort of service rolled out here in Perth, when the evidence is there to show that it works? And interestingly also, it seems to have a more positive impact on the lives of women necessarily than men. The report highlights a lack of women-centric support services in the area, with women who use the medically supervised injecting room being significantly worse off than men across a range of indicators. For example, they are less likely to be in paid employment. That's 0% of female clients as opposed to 18% for male clients. They're more likely to have chronic medical problems, 76 versus 19%, and they're more likely to have experienced severe psychological distress, 67% as against 43%. Members, if only one of Richmond's room aims objectives was achieved here in Perth, that's the one which states that it will reduce the ambulance attendance due to overdoses, I would have expected we would have grabbed that report with both hands, given the current state of our ambulance ramping here in WA. But the truth is, it improves and saves lives and also the quality of life, which should be our primary concern, saving life. It gets people in to see the doctors, it keeps them out of the emergency department, and it improves health outcomes across the board. I would like to see the McGowan government take on board the lessons from Victoria, those set out in Mr Ryan's report, and those in the subsequent report that we're expecting to see in the coming days, and figure out those lessons, what lessons, if any, we can learn here in the West. So let's talk a little about the West. See, I've taken expert advice on the matter. It's evident that medically supervised injecting centres are unpopular. They're resource-intensive and they're costly. They need skilled, dedicated clinicians to drive their success. The inner-city jurisdictions that they operate in, that's Richmond in Melbourne, King's Cross in Sydney, they've endured decades of public nuisance associated with high levels of street drug use and regular overdose fatalities prior to the trial implementations. But following this, there were years of evaluation which proved that each facility had saved lives and made access to medical care easier. Now, Perth is, of course, different to these jurisdictions, both in the type of drugs more commonly injected, where this occurs, and the health and social impacts of this drug use in Western Australia. There are many logistical barriers to the establishment of such a centre in Western Australia, particularly that the problem is not a big enough problem to warrant radical intervention. We need to have clear local data on overdose rates, clear data on emerging risks locally in Western Australia. The Mental Health Commission chairs an overdose monitoring project throughout the Western Australian Overdose Strategy Group and is also involved with leading the development of the early warning system that responds to the development to new and emerging drugs of concern in Western Australia. Now, I think it's probably worthwhile to seek some details from that commission with regards to overdose rates and plans for responses, especially if fentanyl begins to become identified in our illicit drug supplies. So the motion before us doesn't ask for anything more than that, the consideration of the new data by the government and a report back to Parliament in due course. Some of the points raised above should be included in that governmental report. Now, I realise that the location of a safe injecting room here in Perth has the potential to be controversial. But so too was the placement of a homeless shelter not so many months ago, but we still went ahead with that plan, as well we should have, and I think it has found acceptance. This motion calls for exploration and a report, and I have every hope that members on all sides of the House, with all of our varied experiences, all our varied opinions, we will agree that more information leading to change in our practice will lead to better health outcomes. And I dare to hope it might have a broad acceptance on both sides of the chamber. Therefore, I commend the motion to the House.
Members, the question is the motion be agreed. The Honourable Sophia Mormont.
Thank you, President. I thank my colleague, Honourable Dr Walker, for bringing this motion on today. It is an important discussion to have, and that would only be brought on by a party like the Legalise Cannabis Party here in WA. We are not afraid to tackle those issues which this government wants to ignore and put in the too hard basket. Drug injecting users are not often spoken about, especially in this place. Most people, the public and politicians, don't want to acknowledge that drug injection is still a thing. Isn't heroin all 1990s? Well, no, I'm sorry to shock you all, but those little plastic bins dotted around bathrooms, including in this place, aren't always used by those who must inject diabetes medication. Some are used to dispose of needles after injecting drugs, heroin, cocaine, other opioids and methamphetamine too. I understand that the discussion of drug injecting users makes some people uncomfortable, but aren't we supposed to have these difficult discussions here? I've highlighted the need for WA to investigate having a safe injecting facility here before. At one point not long ago, I directed a question without notice when the Leader of the House in this place was Health Minister. Also, the answer was, as usual, dismissive and short. The Minister said that the discussion was had and it was concluded that WA didn't need such a facility. My question to this government, and indeed to the new Health Minister in the other place, is how many dead drug users would be enough for you to reconsider your position? 2 lives, 5, 20, 100? When would it end? As Dr Walker has highlighted, the Andrews Labor government launched a medically supervised injecting room 5 years ago. It took great political courage. It was in response to scores of deaths a year that had... wrong glasses. It was in response to scores of deaths a year that year that had occurred from overdose in the inner city, most notably around the suburb of Richmond. Just recently, a final report was handed down on the effectiveness of the program, and the facility has been made permanent. It hasn't been an easy policy to introduce, mainly because the public, being stirred up by some ignorant politicians who don't want to face facts, don't have a lot of sympathy for drug-injecting users. They are bottom rung on society's ladder, but since its establishment, the Medically Supervised Injecting Room in North Richmond has succeeded in achieving what it set out to do. The policy at the centre of its objective, saving lives. 6,000 overdose events in the facility during the trial, and none, that's right, none, have been fatal. As the Ryan report recently noted, dealing with drug addiction in the community is a complex task, in large part because it requires people with complex needs to interact with a complex web of social, legal and other support systems. Policymakers committed to addressing addiction must find solutions within this complexity while balancing a set of sometimes competing aims, including preventing deaths, promoting health, offering pathways out of addiction, protection, safety and amenities, and generating community support. The report went on to note that supervised injecting facilities aren't a silver bullet, and that needs to be made very clear. This isn't a fix-it-all, but one tool, and a seemingly very successful one that the data shows has a real impact at saving lives. There's a growing body of evidence, including from supervised injecting facilities established overseas, that this type of intervention reduces deaths. It's that simple. It also substantially reduces syringe litter, which is in itself a problem, especially for children. Supervised injecting facilities also give highly vulnerable and disadvantaged members of the community better access to vital social and health support. It is because a safe injecting facility run by medical professionals without judgment is a wraparound, enveloping type of service. Once the user is in the facility, they can be offered other opportunities to help them in their pathway to recovery. Things like housing services, addiction treatment, dental, legal and mental health services. At its heart, an injecting service is a health response. Its main objective to save lives. Yet unlike other evidence-based health policies that prevent death and provide life-changing support, injecting facilities are often highly contested in the public conversation, as the Ryan report stated. But let's be honest, they shouldn't be. Everyone should have access to good health care, not just those who we like, also those who may be judging on the way they look or the way they present. As has been stated, safe injecting rooms drastically reduce ambulance call-outs and presentations at emergency departments. Also, such a facility is a fantastic tool in reducing the spread of bloodborne diseases, including HIV and hepatitis C. Safe injecting facilities are a huge harm reduction measure. The data is clear both in Australia, where we have the Melbourne example, and a 2 decades plus King's Cross safe injecting facility example, and from overseas in places such as Canada. Put simply, safe injecting rooms work. Harm reduction is grounded in justice and human rights. It focuses on positive change and on working with people without judgment, coercion, discrimination, or requiring that they stop using drugs as a precondition of support. And President, we practice harm reduction in other areas all the time. Why should it be different for drug injecting users? You know, we have seatbelts as a harm reduction measure. We have plain packaging on cigarettes as a harm reduction measure. Alcohol tax increases and warning labels on bottles are harm reduction measures. Some may remember when a bad batch of drugs hit Perth in 2019. 3 people died and scores of others hospitalised. If those people had been in a facility that was medically supervised, then there's a 100% chance they would have survived. Obviously, that would have benefited them, but also their family and possibly their children. And when I was in an RN in Amsterdam, I saw the effect of heroin addiction on babies. When I was on this particular ward, I saw 3 babies that went through withdrawals. Their screams as they were detoxing were horrible, loud and piercing, and I will never forget that. They were the babies born of sex-trafficked, heroin-addicted women. They were addicted to heroin to help them be controlled by their sex traffickers. They were made addicted on purpose for that specific reason. Now, providing people with support gives hope. A lot of people with addiction lack hope. They don't have anything to look forward to in their life. People with hope can make change. People without hope are unlikely to have the desire to do so. They want to escape reality. They want to escape the pain. By having appropriate healthcare services and social support services, we can give those people hope, give them the motivation to give up their addictions, help them see that their life can have value. Now, how many deaths of those that we marginalise, of those in the shadows, those in the grip of a terrible addiction, will it take for this government to consider trialling a safe injecting facility in WA? Healthcare should be for everyone. Thank you.
Members, the question is the motion be agreed. The Honourable Brad Pettit.
Thank you, President. I rise to speak in support of the motion the Honourable Dr Walker has moved today. The evidence that he has laid out shows that safe injecting rooms save lives. North Richmond is but another example, and we can see from John Ryan's independent review showing it saved many lives. I think 63 was a number that the Honourable Dr Walker talked about. And I note that this is something that my Greens colleagues in Victoria have certainly welcomed as well. Actually, that this recent announcement by the Victorian Labor government this month that they will make this medically supervised injecting room in North Richmond an ongoing facility. In fact, I noted whilst reading through some of the background on this that the Victorian Greens actually call for backing the evidence-based recommendations actually around actually establishing more smaller discrete facilities across the state where harm from drug use is happening. And I think at the heart of this and why I really like this motion that the Honourable Dr Walker has put forward is this is about actually looking at the evidence and making sure that we actually follow through with policies and programs that back the best evidence that's before us. And this is broadly consistent with something the Greens have talked about for a long time around harm reductions policies when it comes to illicit drugs. The current approach to reducing the harm that illicit drugs cause in our community is clearly not working. And right now, many of the things we are doing to address this issue are making the crisis worse rather than better. For too long, the politics has ignored the research and has left harm reduction approaches under-resourced, restricted us from undertaking innovative trials and putting lives at risk. Investing in harm reduction will provide the resources to expertly examine harm reduction approaches to provide the strong evidentiary base for best policy and practice decisions. The Greens recognise that when we treat personal drug use as a criminal issue, we use vital resources to punish individual users rather than focusing on the illicit drug manufacturers and distributors, who are the real criminals. We are also distracted from the opportunities to reduce drug users exposed to harm and often avoidable deaths. Going back to the North Richmond example, which I think is a really interesting one because there has been a lot of really good research around that and a number of reviews. And there was a review, a 2-year review that actually was of the clinics back in 2020. And interestingly, even back then, they recommended a continuation expansion of further facilities to accommodate the demand. Part of this review found that the North Richmond Clinic has succeeded in its goals of saving lives and managing overdoses. The panel found that the clinic had recorded, this is 2 years in, 119,000 visits in 18 months, saved at least 21 lives back then, and I appreciate that Dr Walker talked about 63 lives up to the present day, and managed 3,200 overdoses and led to a decrease in reports of public injecting in the local community. Staff at the clinic, and this is a really important point, this last one, staff at the clinic were also able to provide more than 13,000 interventions for issues like mental health, housing and family violence. These become really important places for actually addressing the issues that some of the most vulnerable people in our community have and helping them get their lives back on track. I think actually shows the good that these things can do. And as I was looking at this, I was reflecting back on an issue that we had with my time as Mayor of Fremantle, where we obviously weren't injecting rooms, but actually places where there were places where people could swap for clean needles in our communities. And of course, there was a huge community pushback, as there always is around these things when these things are talked about. At the time, Josh Wilson, who of course now is the member for Fremantle, was a deputy mayor in Fremantle. And I remember that he and I were really strong, saying that actually this was important that we had these kind of facilities in our community because the evidence says that it actually makes things safer. And I'll reflect upon that story because when we pushed on, we actually ended up having to use the City of Fremantle facility to get this up. And there was, of course, a lot of community angst about it. As soon as that facility went in, and had been running for some time, there was absolute silence because these things are run well, run professionally, and all those community concerns evaporated very quickly. And I think we can see similar things by having an evidence-based approach to injecting rooms is something similar. When they are run properly, backed by the evidence, certainly as we've seen in Victoria, and probably needs to happen, is having multiple ones of those, not just North Richmond. We can actually see that we can actually take our community on that journey and actually reduce harm in our community. And that's where I want to finish in conclusion, is actually acknowledging that an evidence-based approach that seeks to prevent and minimise harm as the most effective way of managing issues of drugs, whether they're illegal or legal. And on that basis, I'm very happy to support this motion.
Members, the question is the motion be agreed. Leader of the House.
Thanks, President. Now, while I thank the member for bringing this motion to the House, if it was to go to a vote, the government wouldn't be supporting it. I want to start by making a couple of points. I guess primarily I'll start in response to something the Honourable Sophia Mormont said, and I'm paraphrasing, but she made the point that we don't have these debates in this place, that we don't have these conversations. We don't do it because it's too difficult. I never thought that I would get to this point, but I'm at this point now where 20 plus years in this place, I have learnt a few things. And one of the things I have learnt is that public policy does not begin when you enter this place. It does not end when you leave it. So you always need to look at history, and don't assume that just because you haven't seen something happen in the, 2 years that you may have been a member in this place, that it hasn't been debated before, that it hasn't been considered by government before, because it has. Whether it's safe injecting rooms or any other policy, while variations might occur, it's a dangerous path, I think, a risky path to assume that nothing has been considered about this before. So a couple of things. The Honourable Alison Zamon, who was a member of this place twice, in the last Parliament chaired an inquiry into, broadly into drug matters. I think its title was Help Not Handcuffs, Evidence-Based Approaches to Reducing Harm from Illicit Drug Use. And that inquiry travelled around the world looking at evidence-based programs. The other thing that happened in the term of this government is that we established the independent methamphetamine task force, and they looked at this issue as well, about whether or not we should go down the path then that Sydney had taken, King's Cross had taken, and subsequently in the interim period that Victoria put in place in North Richmond. And both of those examinations, in respect to the one by the Honourable, chaired by the Honourable Alison Zamon, the recommendation was that there should be further discussion about this subject, but the government's response to that was no, we weren't interested in pursuing that because we did have a range of alternate evidence-based programs in place. The view of the methamphetamine task force, in fact, was that there is mixed evidence about safe injecting rooms. Now, I think it's a fact they are one tool. They're not the only evidence-based tool. And there are other evidence-based programs and services that are in place that I'm going to go through now. The motion before us reflects the Labor Party's policy, which is that drug and alcohol policy should be based on evidence and what works. And there's no dispute about that. Our policies are based on evidence and what works. That's exactly what we're doing. Our policies, our services and our programs are based on evidence and are designed to meet our specific needs. The main driver of the North Richmond safe injecting room in Victoria was a specific local issue about addicts shooting up in the streets. That's what drove it. It was a specific local issue. Now, whether it's a good thing or not, the addicts in Western Australia, the advice from the Mental Health Commission, the Methamphetamine Task Force and others, is that they shoot up at home. So, good on Victoria for adopting an approach that met a very specific local need for them. We don't have that local need, and we have expert advice that says even if we did have that, there's mixed evidence about the effectiveness or not. But I want to talk about the alternate programs that we do have in place, including about collecting the data, which the Honourable Brian Walker referred to in his contribution. So, the Medically Supervised Injecting Room trial in North Richmond, Victoria in June 2018 commenced following a high number of fatal heroin overdoses in the local area, in the streets, in the preceding years. There have been 2 independent reviews of that service. The first was in June 2020 and the latest, the one that the Honourable Brian Walker referred to, was released in February this year, and they made a series of recommendations. What that Ryan review found, which I don't think the Honourable Brian Walker referred to, was that while there have been fewer overdoses outside in the local area, public injecting and inappropriate discarding of needles and syringes remains a challenge in that area. The Methamphetamine Task Force final report, which I referred to, which we initiated when we came to government, indicates that Western Australia, unlike Victoria, does not have a significant localised injecting drug use population, but rather a home-based injecting culture. The Medically Supervised Injecting Room was effective in responding to a localised drug injecting issue in North Richmond, but given the current nature of injecting drug use in Western Australia, the introduction of a similar model here is not warranted. That's looking at the circumstances, that's looking at the evidence here in front of our eyes now. Our response is indeed evidence-based. But what we do, we do recognise the importance of harm reduction, and I reject the proposition from the Honourable Sophia Mormont that we do not have in place harm reduction strategies. Indeed we do, and we'll adapt those as we need to. We fund and we deliver a range of targeted harm reduction strategies to reduce drug-related harms and deaths in the West Australian community, including the Overdose Strategy Group, which monitors overdose drug-related harms and deaths via police, ambulance and hospital emergency departments and via the use of needle and syringe exchange programs. That strategy group is comprised of academic and clinical alcohol and other drug experts and identifies and recommends harm reduction strategies and approaches to reduce overdose harms and deaths. The Needle and Syringes program provides safer injecting equipment, access to healthcare, harm reduction advice and safer injecting advice. Western Australia has a 97% rate of return of used syringes at those exchange program sites, contributing to reduced bloodborne virus amongst people who inject drugs. And of course, one of the major risk areas for people injecting drugs is not just the impact of the drug on their system, but the risks that come with sharing needles and the bloodborne viruses as a consequence. The WA naloxone, I don't know if I'm saying that correctly, program, which expands access to free take-home naloxone. That's the drug which reverses opioid overdose, provides education to recognise and respond to opioid overdose and how to administer naloxone. The next one is really important as well, peer outreach and education programs. So these are services that regularly engage with people who inject drugs. They provide peer support and outreach to people's homes and to any street-based populations and provide access to free naloxone. The Mental Health Commission Workforce Development Team are delivering training and education to frontline workers to increase their knowledge and skills to reduce drug injecting and overdose-related harms and deaths amongst their clients. Drug Aware, which is the population-based campaign that aims to reduce and delay the intent to use drugs, reduce harm associated with use and encourage help seeking. For example, the Safer Events and Venues campaign targets high-risk settings, including music festivals and night venues, to reduce harm associated with MDMA or ecstasy. The early warning system, which the Honourable Brian Walker referred to. So this is a statewide drug alert system to respond to new and emerging drug trends. That's under development now. That early warning system communicates to health, police, paramedic and frontline workers to reduce drug-related harms and death. And that will be a critical tool going forward to make sure that we continue to adapt our services and programs to match what is emerging as the real problems in our community. I just wanted to touch briefly on the content of that parliamentary inquiry, Help Not Handcuffs, which I think, did I bring a copy? Yeah, was tabled in the House in November 2019. So one of the key recommendations out of that was looking at the harms associated with prescription drug misuse as well. And the government's response to that, I think, is worth noting because it really kind of outlines our general position on these things. And I think it is important for every party in this place, including the party who proposes to be in government, to put their policy position on the record. I'm not sure that that's going to happen today, but we'll see. So the government's overall aim is the reduction of illicit drug use in WA with the objective of reducing harms. With the objective of reducing harms from illicit drug use in the community, including the illicit use of prescription pharmaceuticals. And it talks about then a number of initiatives currently in place to address harm, so that they go to harm reduction, and sets out what those are. Now, when it comes to the issue of whether or not we should have so-called safe needle rooms, at recommendation 31, what that committee said was the Department of Health and the Mental Health Commission consult with service providers and people who use drugs to ascertain the demand for a drug consumption room in Perth. And government did not accept that recommendation. We're not considering a drug consumption room in Perth, though the response did note the importance of harm reduction strategies. So this proposition that we're not interested in harm reduction, it's just not true. It's just not based in fact. Safe injecting rooms are one method that you can use. It's not the only method to address harm reduction, and I think it's ill-informed to suggest it's the only one, and that because we're not doing that, we're not doing anything about harm reduction. That's just not the case. So our response did note the importance of harm reduction strategies, and we continue to support harm reduction initiatives and personal support services, including peer-based support services, which are actually some of the most effective. I mean, if you think about how you learn, one of the most effective ways of dealing with really tricky, really difficult, really wicked problems is peer-based support. So the person who can sit in front of another person and say, I've been where you are, I've walked in your shoes, I know what you're going through, and this is how I changed, and this is the benefits. That is really powerful, and we are supporting those peer-based services. Needle and exchange programs and overdose prevention programs across WA. So the proposition that we are not supportive of harm reduction programs is not accurate. The proposition that the only way to achieve harm reduction is to use safe injecting rooms is not accurate. But this is a wicked problem for our community to resolve. So to the extent that it has us talking about it, I commend the honourable member for raising it, But if the proposition was to draw our attention to our party policy, which says evidence-based should be the basis of all our policies and programs that we've got in place, tick, tick. Of course it should, and that's exactly what's happening. There's nothing in drawing that to our attention which causes us embarrassment, because that's what our programs are based on entirely. We have a range of programs in place to assist people deal with their drug addiction and to reduce harm. Where we can stop and where we can help people come off drugs, of course that's our overall objective, but nobody is naive enough to think that it's a just say no approach. We are indeed about harm reduction, and there are a range of policies and procedures that have been put in place by government, and more importantly, by recognising the need to continually collect data, we're going to make sure that those harm reduction policies continue to improve.
Members, the question is the motion be agreed. The Honourable Kyle McGinn.
Thank you, President, and thank you to the Honourable Brian Walker for bringing the motion to the House today to be discussed. It is a very complex, and there is a long history with how governments have handled this across the world, and there are many different projects and initiatives and laws. I don't think anyone would agree that there is a silver bullet or is that there is a handbook that can be pulled out for each state to follow. And I think that's critical to take on board, is not every state is the same. Not every state is going to have the same approach, nor is it going to have the same issues that it is approaching. And I think that the Honourable Sue Ellery laid that out very well in her contribution, to acknowledge that what did happen in Victoria and the reasons behind them going the way they did was because of the way their issue is being done in Victoria. It is different to Western Australia. And I think you could say that New South Wales would be different to Victoria, and so on and so forth, same as the Northern Territory, but also not just around injecting, but around drug use in general. I think there was recently a report that came out around where they do the sewage testing, and it releases who is the meth capital of Australia, who is the heroin capital of Australia, and etc. And that quite visibly shows that each state has different drug problems. And then within them drug problems that they have, as the Honourable Sue Ellery laid out quite well, is they have different approaches to how they do the drug use. So here in Western Australia, more at home. Victoria, very visible, very on the street, and seems that what they did was appropriate for what they were doing. And I agree with the Honourable Sue Ellery around the fact that our policy for the Labor Party is around the science-based, evidence-based. And we are doing things around that space. And one of the really things I'm proud of in this government, and also multiple federal governments, is in Kalgoorlie, for example. When I first got out there in 2017, there was no detox clinic. Now, to get into rehab, you must detox. So in order to detox, amazingly, there was this gentleman, and his name eludes me right now, but he was a doctor in Norseman, and he was providing services in Norseman, which people from Kalgoorlie were accessing. So your choices were to go to Norseman, which is quite difficult to get to unless you have a licence and etc., or Perth, to detox before you could get into the rehabilitation clinic. Now, that was identified as an issue in the goldfields, and was then created a detox clinic right next to the rehabilitation clinic. I believe it started off with 4 beds and may have expanded now. But that has now created an opportunity for people to get into the rehab by detoxing first. And then I have also had the pleasure of attending the rehab on quite a few occasions. Jane has been an amazing host, and also the participants within the rehab have been very approachable. And to touch on again what the Honourable Sue Ellery said around a peer-based approach, I absolutely believe in that, because I've seen it firsthand. And I think you see it across many issues, not just drugs and alcohol. For example, I know people who are feeling vulnerable and lost that are going through cancer treatment, etc. Their cancer groups end up being a really good support base. I think that in the same vein, you put that into the rehabilitation clinic, as the Honourable Sue Ellery said, there's people that have experienced that before and have tried to get off of drugs or have been successful. You know, one of the big successes of the rehabilitation clinic I'm aware of is that people that have gone through it and been successful and still live in Kalgoorlie get into the program and start assisting people that have drug and alcohol issues. But the other creative way they do is they engage with the organisations within the goldfields that are useful tools to bringing someone back into society who's getting off of drugs. And one of the useful ones is Men's Shed. Now, what I will say is the one in Kalgoorlie is fantastic because it's also a women's shed. They do courses where the rehabilitation clinic, I think it's once a week, the men will go down and they'll work with the tradies and the retirees, and they'll build something, and they'll have this sense of value and this sense of success, which they then share with the other participants within that program, which then drives them all together to get to that end point, which is to stay clean. But it's also the fact that there's constant care, there's counsellors available consistently. I really do feel that that approach has been fantastic in Kalgoorlie, and it hasn't come easy. It's come from advocates, it's come from people who put their time into it, and it comes from government understanding the evidence behind the success. So I do feel that the motion was a little bit pointed around the fact that the only evidence base, when I read it, was the injection rooms. The way that I read it was it felt as though it didn't accept, well, to me, it didn't accept the other approaches. It just said that we needed to get into the injecting room space because that is the space that's being successful. Whereas there are other spaces, I think, that are providing that type of success. Now, that work here. That work here already, and that the government is supporting. And I know the state government supports these things because I've seen it. And also, I want to acknowledge there is a lot of organisations like, for example, women's refuges, women's healthcare clinics, that they sort of take on a role in that space as well. Not just diverting someone to another space like the rehab, but they find themselves having counsellors and tooling themselves up with the kits to try and assist them whilst they're in that other situation. I know I'm a huge supporter, and I know the member for Kalgoorlie, Ali Kent, is a massive supporter of the Goldfields Women's Healthcare Clinic, which is solely based at women's health, but it has a lot of add-ons. So, for example, women that come to that organisation would highlight if there's domestic violence going on, if there's drug use going on, them sort of issues come out because it's that peer support group where they feel safe and comfortable. And then the next step from there, in my view, would be to the detox and then to the rehab. But they tend to stay connected to that first organisation. One of the things you find with drugs and alcohol, I think, is that you have all these different spread outs, and they have different organisations that aren't necessarily connecting to each other. So you go to one for this and one for that and one for this, and it ends up becoming a bit of a mess because you've got to go the other side of town, etc. Whereas I think what they've managed to achieve in Kalgoorlie is everything's really close to each other and they all talk to each other. They all go to different organisations' events, they go to each other's events, and they talk and they communicate and they lobby together as well. And I have to say, in my electorate of mining and pastoral, I haven't had this one raised with me directly. There's been many issues raised with me directly since 2017, I can assure you of that, but this one hasn't been one that's come. And I would accept that being regionally based, it's different in the city, there could be different things, but in the regions I have found that making the service available, such as the detox, has really changed the way people access the rehabilitation clinic. You don't have to travel 6.5 hours by road or 7 hours by train or pay an airfare to come down to Perth just to detox. And I'm sure the Honourable Brian Walker would be aware how hard it would be to get someone into a detox clinic, and a lot of the time they make a decision and it's now. It's right now. And if you don't act now, you find yourself in a situation where they may disappear again and go back into the spiral. I want to applaud Jane and her team at the Kalgoorlie Rehabilitation Service, because they run a fantastic organisation. All the counsellors that put in all the time they do. I do thank the member for bringing the motion, because I think the scourge of drug and alcohol addiction in this state and in the world is a major issue. And we've had many inquiries that have looked at different things. I think we even had the Liberal Democrat view last term around just make everything legal, including airsoft guns. But I think it is critical to understand our government is looking at that evidence base. It is supporting things that are working, and we will continue to do that as a government, because we understand that this is a problem within society around the world. So I thank the Honourable Brian Walker, and I enjoy listening to the rest of the contributions. Thank you.
The Honourable Stephen Pratt.
Thank you very much, President, and thank you, Honourable Dr. Brian Walker, for bringing this motion to the House, because it gives us an opportunity to talk about an area that the McGowan government has a really strong record in. And we're also not just talking about cannabis for a change, which is nice. It is drugs, though. So, look, I wanted to take my feet today because I do have a bit of an understanding of the government's role to date in this area, and what this government has had a strong focus in this space is on prevention and early intervention and treatment. And so, whilst you may have your thoughts about injecting rooms being the key to solving some of the problems, what we as a government have made our focus on is getting into the space of prevention, early intervention and treatment. And I know the Honourable Kyle McGinn spoke about our meth plan, and I know that your motion refers to Labor policy document saying that we should use evidence-based information to develop our policies. So what we did with meth was a long process. We established a task force. They produced a report after a really broad consultation with the community, all the key stakeholders, delivered a report to the government, and this led to the McGowan government investing over $250 million. So that big sum of money went towards a range of initiatives. One that I've mentioned is early intervention and treatment, and that focus comes through clearly in the meth action response, but it also comes through clearly in the Mental Health Commission's 10-year plan and the government's state priorities for AOD plan. So you can see that all these initiatives and government agencies are working together on the same focus. The MAP, which is the Meth Action Plan, also focused on an expansion of specialist drug services into rural and regional areas of need, as the Honourable Kyle McGinn mentioned, improving drug and alcohol programs in our schools, creating drug and alcohol facilities in rehab for prisoners. And I don't think anyone mentioned that, but that's been an extremely important program and an extremely successful program. And we also increased roadside testing as well for both alcohol and drugs. The Honourable Kyle McGinn mentioned the wastewater testing. He called it sewage, but it's wastewater testing. Someone has the lucky job of collecting samples from the wastewater and testing it. And what we saw, I think, early in the first term of the McGowan government was a really high rate, and the papers had a bit of fun saying, you know, meth capital of Australia, all that sort of thing. Well, following the introduction of our strategy, this figure went down significantly, and I'm sure that it has continued to decrease as well. But it was, I think, coming into government, obvious that meth was a problem in the community, and we had to act. And we did. So I will touch on those two strategies that I mentioned that the Mental Health Commission and the state government have developed over time. The first one is the 10-year plan. Now, that was actually introduced before we came into government in 2015, and there was a thorough process of consultation, evidence-based feeding into it, and that is a strategy that, as the targets are met throughout the progress of that report, it is updated as we go along, and obviously things change as time progresses, and we can adapt to the way the world operates and approaches these types of issues. And I always say when I have discussions around both mental health and alcohol and other drugs, we're playing catch up. You know, this stuff was taboo. You wouldn't be talking about alcohol and other drugs in this place. You wouldn't be talking about it with family members. You'd be trying to hide it away. And I think that has completely flipped, and for the positive, and we're able to talk about these issues and we're able to support people in the community. So coming back to some of the services that we've implemented, certainly in the regions, this provides such a great benefit to people who are in desperate need of these services, and it's closer to where they live, closer to their sort of support network and family members. So this is the strategy that we've decided to put our focus into, because it's so important that people can access these types of services, get the help and support that they need so that they don't continue to use drugs into the future, potentially. And if they do, then there's safe places for them to go and get support and some counselling as well. So in terms of those focus points on prevention and treatment strategies, the government has chosen to prioritise these because we believe that it will have a more significant impact on reducing the harm caused by AOD use in the long run. Prevention strategies that I've mentioned, such as early intervention programs, health promotion and education, strengthening communities, and the aim to reduce the prevalence of AOD use by addressing the underlying factors that contribute to substance abuse or use and abuse. On the other hand, treatment strategies such as integrated care, culturally appropriate care, and evidence-based treatment aim to support individuals with AOD-related problems and help them overcome their addiction. These strategies have been proven to be effective and can improve the physical, psychological and social wellbeing of individuals with AOD-related problems, and that brings a greater benefit to the community. And I know this motion had a strong focus on what's happened in Victoria and how there's been some success with, I think they're staffed safe injecting rooms. And while they have been implemented in other parts of the world, our government has decided not to pursue this strategy because our focus has been on the other ones that I've mentioned today. So in closing, safe injecting rooms may not be, from my perspective, the most effective approach to addressing AOD-related problems in our state. Instead, we've chosen to prioritise prevention and treatment strategies that can have a more significant impact on reducing the harm caused by AOD use in the long term. So, and whilst I say that, I think we can always do more. So more investment in prevention, and that goes for all ranges of healthcare provided to citizens of Western Australia. So I thank the member again for bringing the motion to the House, because it gives us an opportunity to talk about something that is significant. It's very important. The more we can talk about these issues, the more people can feel that it's a safe space to actually seek help, reach out to someone that they know, and hopefully live a long and healthy life. So thank you again for the motion, and to the other members that have made a contribution today.
President.
The Honourable Martin Pritchard.
Acting President. I want to thank the Honourable Brian Walker for bringing this motion to the House. I think it's always worthwhile talking about this particular area of society. I often get into trouble with my family because I relate to things very personally, and my interaction, unfortunately, has been with my nephew, and I've spoken about it on a number of occasions, and his particular addiction is meth, or was meth, hopefully was meth. It's always worthwhile talking about these things, and I do appreciate you bringing it to the House. But I did do a little bit of research last night, not much, unfortunately. I had a bit of positive news, or negative really. My mother-in-law had cause to call an ambulance yesterday morning, and it arrived within 10 minutes, which is great. She's in hospital and doing well. So a bit of positive. But with regards to the safe injecting rooms, the research I did, and there are a lot of positives, but it does, and I want to pick up on the Minister's comments earlier, it is really very specific to a particular problem. And so I had a bit of a read with regards to the one in King's Cross. And of course, King's Cross has a reputation and a high drug use area. And one of the things that, well, two things that came out of that I thought was really worthwhile highlighting, and it does seem strange, but it does sort of add to this argument of ours where it's not probably the best approach here. And that is one that they suspected that it might have what they call a honeypot effect, where it would actually draw people in to use the facility. With regards to the King's Cross one, that doesn't seem to have been the effect. So it is a high concentration area of drug use and other things. So there is a reasonable usage of that facility, but it doesn't seem to drag people in from outside. And that sort of goes to the point that the Minister raised, and that is that in Western Australia, we seem to have a different way in which users take their drugs, and it's usually from home or in that sort of environment rather than streets, which it is in King's Cross. And it's been suggested, and I didn't read this, but it's been suggested that it was the same problem in Victoria, where it was mainly the street use, the needles and such so it had a positive impact on the ones that use the facility, but also a positive impact upon the society around that area, or the people around that area. So, for them, it's probably a very good way of going. For us, it probably would have little impact if it didn't actually draw, and I'm not sure you want to draw people in to the facility, but it doesn't seem to do that. The other thing that my investigation seems to suggest is that individuals don't use it all the time. So they use it occasionally. And it's sort of suggested 1 in 35. The figures may change, obviously, with different individuals. But they use it when it's convenient. And so there are many, in what I read was 1 in 35, which I think is very low. But even if it was higher, even if it was, 1 in 20, there's still a great chance of them overdosing when they're not actually in the facility. So I think that if we had the same issues as in King Cross and in Richmond, it would be genuinely a good thing to talk about and to investigate. But I think if you look at the habits of the users in Western Australia, it certainly wouldn't be the thing you'd go to first. And I think, and I didn't have enough opportunity to look at the other things that this government and previous governments have done, but there are many things that are happening, and obviously it's been determined that those have a greater impact and greater effect than what an injecting room. So I won't be supporting it, but I'm glad you brought the motion to the House. It is always worthwhile talking about. It is a scourge on society everywhere in the world, and certainly here, and the impacts of it on family life when one member of a family chooses to go down that path. It's not just them that it impacts, it's the whole family and the extended family, and it's quite devastating, as I can personally attest to. So thank you very much for bringing the motion, but I won't be agreeing with it.
The Honourable Dan Kelly.
Thank you, President. I rise to speak on this motion, the safe injecting
motion brought to the House by the Honourable Dr. Brian Walker, and I say from the outset I won't be supporting the motion, but I'm glad he brought the motion to the House. It is a chance for us to talk about something that's important. Drug use is a vexed issue for all of us in society. I have heard now on a few occasions the Honourable Martin Pritchard, my good friend, speak about the consequences of drug use in his extended family. And every time I hear that, it gets to me because in my extended family, there is a similar story. And it is difficult. I want to commence just by analysing the motion a little bit, because there are three limbs to this motion, and the first and the third limb, speak to the Richmond medically supervised injecting rooms, and other speakers have already gone into detail on this, so I won't speak for too long on this, but I just want to reinforce what others have said. This clearly was a success, but it was a local program designed very much to combat what was a very local issue. And as the Honourable Kyle McGinn said quite eloquently in his speech, or in his contribution, we really need to be cognisant when we're tackling this issue or any other important issues in society, societal issues, that we don't just look at what has happened elsewhere, whether it be in another jurisdiction within Australia or whether it be overseas, and say, wow, that was a success, we should do that here. Because we need to recognise that of all the problems that we face in the world as a whole, societal problems are exactly that. They are problems that often are very specific to our society and to our local area. So it is, whilst that was a success, it is very easy to distinguish as to why that may not be the best approach to take in Western Australia. And I will talk later, if I get time, about what this government, some of the things this government is doing in Western Australia. But I wanted to touch briefly also, because injecting rooms, they're a specific type of drug that is injected, and I want to look at the most recent drug use statistics in Western Australia, and these are from the Australian Institute of Health and Welfare's National Drug Strategy Household Survey, and they look at there's a lot of factors they look at. The amount of time since people last used what is classed as recreational drugs. I'm not sure I like that. I like that nomenclature. But one of the things they look at is the type of drugs that are used in Western Australia that fall into this category. And the first thing I would note, the headline on this report, which is comforting, I guess, is that the Western Australia is now experiencing the lowest proportion of illicit drug use since 2001, and I think that is a good thing. If we look at the state, at the moment we're looking at according to this report, 1 in 6 Western Australians who engage in what is called illicit drug use. 51% of those are engaging with cannabis, which is not a drug that is injected. The next highest is ecstasy at 13%, which is also a drug that is taken orally, that is not injected. And then the next is methamphetamine, which can be injected, but in general, in Western Australia, is my understanding, that is not the preferred method. So that's nearly 3/4 of illicit drug use in Western Australia that is not made up of drugs that are injected. And I did want to run through some of the government-funded services. The Honourable Sue Ellery, the Leader of the House, went through most of these, and so I won't go through all of them, but the one that I really wanted to pick up on was the needle and syringe programs, because this goes specifically to the issue that the Honourable Dr Brian Walker is talking about. So the needle and syringe programs provide safer injecting equipment, access to health care, to advice on harm reduction, advice on safer injecting. And as was pointed out by the Leader of the House, Western Australia has a 97% return rate of used syringes at needle and syringe exchange programs. And obviously this is a very important contribution to reducing bloodborne viruses among people who inject drugs. There are also many other programs, and I think the Leader mentioned them, the peer outreach and education programs, the stuff that the Mental Health Commission is doing as well. But one of the things, because I'm going to run out of time, I wanted to talk about was other organisations funded either partially or wholly by the state government who are doing great work in this area and in the area of tackling drug use, amongst other things. And I really wanted to talk, and I've spoken about them before in this place, about Pickies in my electorate. Pickies is fascinating because they have a focus on homelessness. They have a focus on homelessness and people experience homelessness with mental health, young people experiencing homelessness with mental health, with also drug and alcohol issues or addiction issues. And they really take a holistic approach. They look at everything and they say, this is this person, this is this individual, and they tailor a lot of what they do to the individual circumstances. And they have programs around emotional, physical and material well-being, interpersonal relationship development, personal development and self-determination, which is incredibly important. It's one of the things that drug users and heavy drug users struggle with, a whole lot of these issues. And so Pickies, and especially through their Pillar program, they recognise this and it's important to what they do. And I've quoted their statistics before, and I'll be quick, but of the most prominent issues of the people that come through Pickies, when they list their prominent issues, homelessness is at the top, but drug use is right up there as well. And that is important to note. And I just wanted to look at, if I can, a case study from Pickies, and I'll be very quick. This is a case study about someone called Sam who was referred to Pickies by Headspace. During the time Sam was at Pickies, Sam started to engage in sex work, and whilst that was going on, tried methamphetamine for the first time. Initially, staff worked on abstinence. That didn't work. Then they worked on harm reduction techniques. Sam continued to use, and I'm reading directly here, continued to use and start to inject, and staff went through safe injecting practices. So Sam then continued to use drugs, to engage in high-risk behaviours. This was straining the relationship at home. Pickies worked with Sam right the way through from the point that Sam started engaging in that drug use, trying different things all the way through and targeting what they were doing to where Sam was at in that cycle. And I'm happy to report, and this is now a year or two old, but at the time of writing, they got there. Sam had become drug-free, had been drug-free for 6 months, was living again at home, studying at TAFE. So that's a real success story that comes from actually tailoring what needs to be done to the individual and making sure that that all through that process, the individual is being looked after. And so this is the power of funding going to the right places, from whether it's drug-related issues or homelessness, to a stable living environment, then to full-time, ensuring people get into full-time study. It's about putting the money where the money needs to be. The Leader spoke about peer-based support, and I really wanted to talk about this as well, because this is something that the government continues to support, peer-based support programs for people, so they can hear from others who've been through what they are going through. But I'll run out of time. I won't have a chance to speak about that, maybe later.
President.
The question is the motion be agreed. The Honourable Peter Foster.
Thank you, Acting President. And I also too rise to speak in opposition to the motion moved today by the Honourable Dr Brian Walker. One of the things I was most disappointed about with the motion today, well, actually two things. One was that you actually didn't use the most up-to-date WA Labor Party platform. We actually have a 2021 Labor Party platform, so I suggest that you update your notes. And then the second thing that I was disappointed was that we didn't actually talk about any of the services that are being provided already. Well, you didn't acknowledge any of the good work and any of the organisations that are working in this space, and it was really pleasing to hear that members on this side of the House talked about some of the organisations and some of the good work that's happening, particularly in the regions. I know the Honourable Kyle McGinn talked about Kalgoorlie. Up in the Pilbara, we also have some great organisations doing work tackling drug use, including the Bloodwood Tree organisation, which is based up in Port Hedland, and Yandina, which I've actually had a bit of experience with Yandina because prior to coming to this place, I worked for Child Protection, and I actually referred some of my clients to Yandina for sobering up and for rehabilitation. One of the first visits that I made in Perth when I was sworn in was to visit the WA AIDS Council, that's now known as WAC. And they're a great organisation. They offer a lot of services, and one of the services that they offer is needle and syringe exchange. And now this program is actually funded through the government, through the Department of Health, and also through the Mental Health Commission, and also by the WA Police. So, our government is investing in programs to, keep our community safe. I know a few of the members today have quoted the Help Not Handcuffs evidence-based approaches to reducing harm from illicit drug use report of 2019. And in there under recommendation it says 31, it says the government rejected injecting rooms based on the fact that there were safe alternatives. Now WAC are providing some safe alternatives. I had a look through their 2021-2022 annual report just to get a bit of an idea of the services that they provide. In that financial year, they provided 1.14 million, I'll say that again, 1.14 million needles. They have just under 6,000 needle exchange clients. They provided 5,500 interventions for needle-using clients, and they case manage as well 5,500 clients. So they're actually doing some great work right here in Perth, and I want to acknowledge the great work of the CEO, Lisa Dobrin, who I've met on a number of occasions, and her team there for the work they're doing. Now, this particular drug needle exchange program actually doesn't just operate here in West Perth. They have operations in Mirrabooka, in Joondalup, in Fremantle, in Belmont, and in Gosnells. Now, they actually have a van that they drive around and service those places. As well as obviously the needle exchange in those vans, they also promote safe sex. There's counsellors available, and often those interactions at the van lead to follow-ups, lead to counselling, lead to intervention. So I just wanted to acknowledge the great work of the WA AIDS Council. I know we've been talking today about the safe injecting rooms, and I think it was the Honourable Martin Pritchard that talked about the King's Cross example. Prior to moving to WA, I lived in Sydney for a number of years. I worked for Centrelink in Maroubra and also in Redfern. And I've seen very much firsthand just how much drug using happened on the street. At the Centrelink office at Redfern, when you exited the building, you would see the drug use straight away. People would just it was a quiet spot and they would inject. So I think the King's Cross example, as the Honourable Martin Pritchard highlighted, was in regards to a particular problem, the public use on the streets, and that's why they've set up that service. That service has been in effect since 2001, and it's run by the Uniting Church over there in Sydney, and it's funded through the City of Sydney, so it's a local government and state government through the Department of Health working together to get that drug use off the street. I'll leave my contribution there because I know that there's another member that would like to contribute, but I will, as I said, I'm opposing this motion today, and I want to thank the WA AIDS Council, WAC, for the good work that they're doing for their needle exchange program.
The Honourable Shelley Payne.
Thank you, Acting President. Thank you to the Honourable Dr. Brian Walker for bringing this motion today about injection rooms. And I just wanted to follow on from some of the comments that was made by the Leader of the House this morning with regards to the committee report that was tabled in November 2019. I wanted to just thank the Honourable Sam Rowe, and I know the Honourable De Gressa was on this committee as well, although we haven't heard him talk today. I guess one of the things in this report, there is a section in the report that talks about drug consumption rooms. And I guess the key thing that I wanted to say was with regards to these drug consumption rooms, that one of the important things that this report talks about is actually the fact that it provides access to support services, noting the primary objective is to save lives by preventing overdose deaths. One of the benefits is actually facilitating the contact with health and social services. For example, it talks about the King's Cross Medical Injecting Rooms. 70% of the people hadn't ever accessed local health services, and more than 12,000 referrals were made to external health and social welfare services. And this just really brings me to the point that the Honourable Stephen Pratt was really talking about, and the government's sort of like response to this report is really the importance of harm reduction strategies and our continued support of harm reduction initiatives, personal support services, peer-based support services, needle and syringe exchange programs, and overdose prevention programs across Western Australia. And the other point that I wanted to make with regards to this report was that there were quite a lot of submissions about the fact that Western Australia is small, and actually we're quite sprawled out in terms of our area, and that in that respect, is it a practical thing for us to have here? And thank you. I'll leave my comments there.
Members, the time allocated to non-government business having lapsed, that motion lapses, and we move to private members' business.